dear friends and colleagues. My name is Serap Çiftçili and I am an academic member of Marmara Medical School Family Medicine Department. And this is our primary care unit. Let's go inside. Let me put on my mask. As you see here, there are no patients now. Normally, we have at least 10 patients waiting for doctor visits here. But since our government has advised to stay home most of the time, our patients are much more like waiting at home and very rarely visiting our primary care unit. Let's move. This room is our isolation room for possible COVID-19 cases. Our government's advice is to have the patient wait in a room, and we have an emergency contact, and a vehicle or car comes and takes this patient to the hospital. Let's move on to other units. Here are our nurses, Semiha and Emine. They are wearing scrubs now. Normally they don't wear scrubs. But since we have this epidemic, they started to wear these clothes because it's easy to wash them. This is our room in which we examine our babies and do their vaccines. We have separated this room from other parts of the practice so that our babies do not meet our patients. Let's now move to the part that we do examine our patients. Hi.
Hi.
Dr. Özlem.
Hi, I am Dr. Özlem.
Yes, please, you can introduce yourself.
Okay. COVID-19 has become a public health problem, and we, as family physicians, take precaution related to this. For example, we take only one patient in the room. Patient's relative waits for his patients outside our clinic or family health center. We request the patient sit a few feet away from our desk. We use personal protective equipment. For example, we wear scrubs and white coats, laboratory glasses, a surgical mask, and surgical gown. We often open the window and ventilate the room, and we plan to clean up our clinic at certain times during a day. We want people over 65 years old and people with chronic diseases to stay at home, and if they have complaints about their health, we call by video. We recommend hand washing to every patient who comes. If they have respiratory tract infection, we say them wear a mask and to stay less 1 meter distance from other people, and we reserve a room for people COVID-19 possible patients. If these patients are possible for COVID-19 case, in our first examination, we isolate them in that COVID-19 room, and we call an ambulance. So that's all. Thank you.
Okay, we thank Dr. Özlem that you have explained what precautions we have taken for this epidemic. Okay, that was all from our window, and we wish you all a good day, and we wish you We wish all the health care workers in the world be safe in these very difficult times.